Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, Meldita's Info Corner, and this is my Facebook, johnregacho@yahoo.ca. Okay, so we have here a kidney transplant presentation. Okay, and this is a continuation. So we have here a kidney transplant surgery schedule. So there's the so-called book or scheduled surgery, and there's also the so-called on-call surgery. For the book or scheduled surgery, we have a patient that has a compatible donor, and they will have surgery on the same day. But I did not mention this last time, that there is the so-called also swapping of donors, the so-called kidney paired donation. It's a program actually. So here there's swapping of donors. So let's say we have two patients here. Patient 1 has a donor, but they're not compatible. Patient 2 has a donor, but they're not compatible. So they look for other donors that they are compatible with. So luckily, patient 1 is compatible with the donor of patient 2. And patient 2 is compatible with the donor of patient 1. So they should be of the same age, and their health status should be the same. Okay, so that's called the swapping of donors or the pairing system. But the same, they will undergo process, the compatibility, etc. And then they have a scheduled surgery, and the surgery will happen on the same day. So how about on-call surgery? These are the patients that are waiting for donors, okay, and they are waiting for calls from the hospital. So luckily, Friday, for example, a patient waiting for donors suddenly gets a call from the hospital saying there is a compatible donor with them. So they advise this patient to be admitted the following day to the hospital, and then followed by surgery the following day. Okay, so in this case, whether the surgery is booked, whether the surgery is on call, they have to observe things one day before admission. Okay, let's say Friday. So one day before admission, the patient will take a bath or shower. So take a bath or have a shower. Be sure that they bring their home medications in the hospital, and CPAP machine if they have on the day of admission. If they're taking blood thinners, for example, warfarin for the atrial fibrillation, but luckily they are in sinus rhythm, this is the advice of the transplant team, they will stop taking the blood thinners. Okay, that is one day before admission. Okay, so Saturday, the following day, the patient will be admitted at the transplant unit, okay, by the transplant RNs. So here, pre-admission papers are already done as an outpatient, so nothing to worry about paperwork. The transplant doctor will see and speak to the patient briefly, but the explanation about operation had been done before during the dialysis period of the patient. So the visit will just be briefed by the transplant doctor, okay? And if the patient is taking warfarin, which they stop a day before coming, the patient will get, will have, I should say, a blood work done, and they will check the baseline INR, and the patient will get vitamin K. If the INR is still high, probably another dose of vitamin K, but their aim is to see that the INR level is okay before the operation. By the time, the following day, the INR will be already okay. And also, the patient can eat or drink before midnight. Then after midnight, no more drinking and no more eating. Okay. So the day of the surgery, which is Sunday, or the operation day, as I told you, my last video spoke already about the surgery. So the duration of surgery takes 4 to 5 hours. So 4 to 5 hours. Well, cases vary, of course. If the case is pretty straightforward, uncomplicated or uneventful, of course, the duration will be shorter. If the case is complicated, then the duration of surgery will be longer. Okay? So the next video will be about PACU entry from the OR. Okay, thank you.